We have had in this country, and it's even across the world, but America seems to be leading the way, an obesity epidemic, where we've seen people just in 1990s, where only 10% of the country is considered to be obese, to 2000s, 20, to now over 30% of the country is considered to be obese. What happens when all of that weight comes along, all these other medical problems come along. And so what we found with bariatric surgery is, if we can do a sleeve gastrectomy or a Roux-en-Y gastric bypass and see those great results, and you lose that weight in the first 3 months, 6 months, a year, and get back down close to a normal weight, all those medical problems are going to melt away. And suddenly you have a patient who no longer has to take insulin, who no longer has to take high blood pressure medicine, who no longer needs their CPAP machine, and can sleep normal just like they did maybe 15, 20 years ago.
So as a bariatric surgeon, it's a unique situation to be in. Is I get to see a patient who is most of the time, or a lot of the time, 100 pounds overweight. And post-operatively, I get to see them with 100 pounds off. And it's amazing how powerful that is for a person. It changes their life. Seeing somebody come off of their high blood pressure medications, seeing somebody come off their diabetic medications, it's powerful. Not only has it helped them from a financial standpoint, but from a personal standpoint. When I see patients on the front end of surgery, before surgery, there's nervousness, there's anxieties, and it's really intimidating to sort of dive into this pathway. And then on the back side, I get the pleasure of seeing these patients after surgery. Lost 100 pounds. They walk down the hallway, the way they walk is different, the way they carry themselves is different. It's a huge impact, not just from a physical standpoint, but a mental standpoint. And so that's powerful to be able to see that with the surgeries we do.